Good morning. My name is Tom McCary, and welcome to the Overdose Safety Planning information session. I want to give a quick thank you to the Ulster County Department of Health and the Healing Communities Study for making this initiative part of the projects going on here in Ulster. We are providing trainings to health professionals throughout Ulster County, working with those who are at risk of overdose on using the overdose safety plan and accessing it online for completing it with their clients. As you're probably well familiar, the acceleration of overdose deaths continues year after year. And the data just came out for 2020, which showed a 30% increase, over 93,000 deaths across the country. And this is data which is, and lives which are mirrored here in Ulster County as well. And what we know is that these deaths are being driven by synthetic opiates, fentanyl, carfentanil, and other synthetic opiates. And also that deaths involving cocaine due to the increased prevalence of contamination from these synthetic opiates is also increasing. When you pair that with the with still the information and the fact that very few people who have substance use disorders are receiving specialized care. About 90% of individuals who could use substance use treatment are not engaged in special care. So this all together comes together and says that each one of us, wherever we lie on the continuum of care, has an important role in talking about overdose risk with their patients. We can't assume that they're getting this message elsewhere, and we honestly can't wait to have somebody else talk with our clients and our community members about their risk of overdose. So this is also echoed by the CDC in their recent Health Alert Network on the relationship of COVID-19 and overdose deaths. These are just some of the recommendations I pulled out from that newsletter because they relate most directly to what we're doing with the Overdose Safety Plan and right here in Ulster County. So the Overdose Safety Plan is something that can be used, as I said again, with individuals and implemented by health professionals regardless of their expertise in substance use treatment. We provide training and explain, which helps staff understand their role and how to implement this and use this collaboratively with their patients and catching people early wherever they enter the continuum of care. It pairs very nicely with our efforts to expand overdose education and naloxone distribution, educating clients about the prevalence of fentanyl, helping people make sure that they have access to naloxone, that their family members and friends have access to naloxone. This is something which we emphasize throughout the training and make sure that every staff person who's accessing the safety plan portal knows how to help their clients right here get naloxone if they don't already have it. And it emphasizes risk reduction practices. Expanding treatment also recommended by the CDC and is a intimate part of safety planning process of identifying the current treatment and also the gaps in care that may be being experienced by any client. And they also emphasize that transitions of care, like being discharged from the jail or hospitals, are very high-risk periods. And here we have staff, we have people in these roles who are working with people during our clients and our community members during these transitions of care. And so the safety plan is nested really well with these this services. So it's helpful to start before we even take a look at it, say, well, that's great, Tom, but what is a safety plan? So safety plans are a collaborative, brief intervention which identifies an individual's risk factors for overdose and creates a customized plan. At the end of the day, it's a 1 to 2 page document that they create together with a staff member about their risks, their their resources, the things that they're already doing to stay well, and it changes the conversations that they're having with that provider and all of their providers around substance use, around medication use, and has a very open and honest conversation. This models the best practices used for addressing suicide risk. So safety planning has been a foundation of addressing suicide risk for quite some time and has been shown to reduce suicide deaths of high-risk individuals by 50%. It's structured in the SBIRT model, so the safety planning intervention itself includes a screening for risks of overdose, a brief intervention. This is the overdose education, naloxone distribution, talking with overdose prevention strategies, and then referral to treatment, right? We're through this process, we're identifying where there may be gaps in care, where they've been falling out of care, or would be interested in access to services like medication for opioid use disorder. The intervention itself is rooted in the principles of motivational interviewing, and throughout the training that we do with each staff person, we use examples throughout the training and model how we use motivational interviewing to best engage patients in this and clients in this in completing the safety plan. And it's a excellent framework for providing overdose education and naloxone distribution. So I want to give you actually show what the safety plan looks like. So as I said, next, I really want to give you a walkthrough of what the safety plan is. We talked a little bit about it, some of the modalities which are utilized in facilitating the safety plan. So here's our website, zerooverdose.org, to access the safety plan. So each person who completes the training will receive an individualized user login to the safety plan portal. So on our site, after you do the training, you would click on this. It brings you to JotForm. JotForm is the platform that we use, and it's a secure platform. Each individual user gets a login. It has cute cartoons used in JotForm as well. Once logged in, it takes you directly to the you can see here the overdose safety planning form. So from here, you can either view the form or view submissions that you've already completed. So first, I want to show you that the form, but this is really helpful to know that each person can come back, they can see how many safety plans they've completed, they can view these, they can edit and revise them with their clients as risk factors and prevention strategies change over time, and care over time, they may be more engaged with additional care, and you can update the phone numbers, update the contacts, and show this progress over time, and hopefully also show there is decreased risk factors. They're changing how they're using substance to be more safe. So let's take a look at the form. It is very easy to use, and again, this is collaborative. So collaborative means that we are doing this together with the client. It's not something that I complete and then I show to them and say, here's your safety plan. No, this is an intervention. This is a conversation. Each a section of this is really talking points. It's a structure for having these conversations. So pretty much everything in here is voluntary. If they did not want to put their name on it for some reason, they don't have to. The information is kept secure, so only at the end of the completing the safety plan, it gets shared with two people. It gets shared with the staff person who helps complete it with them, and it can get emailed to the client if they choose to receive it by email. Otherwise, It's stored securely on our platform and can be accessed by the staff person who completed it. So step one goes through different risk factors for overdose. These are again are all talking points. After the training, we provide each staff person with a detailed list, each one of these items in the risk factors and prevention strategies with talking points. So we want to make sure that everybody who's completing the safety plan with clients feels comfortable to talk about the most common risk factors and overdose prevention strategies, right? We want this to be an accessible intervention, not something that's only for specialists. So we have resources. It talks about, why are breathing issues a risk factor for an increased risk factor for overdose, right? It talks about, so we have some talking points on COPD and asthma and that relationship with fatal overdose, which is when the breathing slows down and less oxygen goes to the brain, right? And so we have these in categories of different risk factors, how somebody uses, oops, let me go back. So these are our different risk factors, right? How somebody uses. So we may select some of these. Perhaps this individual is using prescription opiate medications that they are not prescribed to them. So they end up buying different medications to whatever is accessible to them, and they sometimes use them with alcohol. Or just pick two common ones that are that may happen. So this person uses opiate pain medications, and then they use different strengths because they just oftentimes purchase whatever they can get, and they sometimes use that while drinking. So here we then bring them to risk factors that they can take to reduce the risk. And so for somebody who is, we want to always make sure that naloxone is a part of everybody's safety plan. If they don't have it, we want to make sure that we have a concrete plan on how they're going to get naloxone. Let's say that this person didn't have it, but they're really interested in it, and we're going to help connect them to an organization, or even better, we have them on hand that we can dispense to them before they walk out the door. So we talk with them about the increased risk of using by themselves, and then for somebody who is using perhaps medications that they don't know what the strengths are, or they're using different strengths, we might help them talk about pill identifier apps and websites that they can help identify the strength of the medications so they're more informed about what they're using. We're going to keep it simple, but so for each one of these, we have talking points and can cover that with our clients as well. Step three is things that people do or want to do to stay well. Again, we're wanting to connect people to care, identify the things that they're already doing, right? So if they're attending support groups, or if they were in treatment and they want to continue treatment or start treatment, this is great. We want to have this as a part of their safety plan. And then also identifying that they have strengths and they have coping skills that they may be already using. People who they can call and support their wellness. Right, we want to have this names and phone numbers. Oftentimes people say, oh, it's in my phone, I don't need to put their phone number down. Well, I remind them that this is for them, this is not for me. I'm not calling their supports, but it's always seems the case when somebody's at having a crisis, it's the same time that they've lost their phone or their battery is dead. And so having somebody's contact information on a safety plan can be, really a difference between worsening crisis and getting help. Professionals, so we ask them sort of who's their care team, where are they already getting services, and this is an opportunity for us to start understanding their engagement in care. If we don't already know that, we can ask questions like, "Oh, that's really great. I didn't know that you were going to this program. How is it helpful? How frequently do you go there? How do you access them when you need them between appointments?" And so you can identify if there's gaps in care, if they need assistance in getting more engaged. Professional agencies they can contact for help. So this is an opportunity to really make it individualized. If we've noticed that somebody has risk factors, perhaps they could benefit from having harm reduction materials like fentanyl test strips or safe injecting. So we might offer them and recommend them to talk with the Ellenville Regional Hospital and their harm reduction program, so they can get resources and materials to help stay safe, or the mobile syringe exchange in Kingston, right? And so this is where we can really make it specialized to what can be most beneficial to them. We want to ground this is step 6, why the person wants to live. So we want to ground this in what's valuable to them. Why are we doing this in the first place, right? Why we want them to be alive? Why do they want to be alive, right? And so this is a good way to reinforce that this safety plan is about them. This is not so that we have something a chart of theirs that looks good, right? We're doing this because we really want to make it for them. Action oriented, the last step is to identify what they're going to do next. So maybe for this person, we were able to get them naloxone, and then also they had never heard of pill identifier apps, and we were able to show them what they are, and they could download one right there. So their 2 next steps is getting trained in naloxone and downloading a pill identifier app. That would be awesome, right? And so if they would like to have this emailed to them, you type in their email address twice. The provider does include their name and email address, so it gets sent to them. And if the client wants to have their email address, then they also type that in. We have them type it twice so that it reduces the likelihood that this information gets sent to a wrong email address. So protecting patient health information is our utmost importance as it is for you. And so we both share steps on making sure that this is used correctly. And so there's an acknowledgement that says that this safety plan is being shared with them and the staff who helped them complete it. It also acknowledges that we provide Ulster County with some de-identified information about their use of the safety plan. So it doesn't include their name, their contact information, their supports. It includes like how many people did we complete the safety plan with, and what are some of the risk factors that were common. And so we want to have the clients understand that some of this information all of the information is being saved, but only a small portion of it without their personal information is being shared. So we've also included a signature trackpad. This works on with a mouse or by finger if you have a portable device. It renders really nicely, regardless of what type of device you're using. So this is just going to be an example of what it looks like when it's completed. It can be printed out. It's saved as a PDF. It can be printed out. Usually 1 page. Sometimes it runs onto 2, depending on how many items you fill for each of these. And you can always go back, edit the submission, create a new one. It downloads as a PDF. It's already emailed to whoever has shared their emails, the client and the provider. And then the provider can go back at any time to edit it as well. So I hope that this training session was helpful. We are excited to be working with Ulster County on this. And so thank you so much for taking the time to watch this information session. I hope that you feel that this will be helpful to you and your team here in Ulster County working with individuals at risk for overdose. The training is about an hour. We routinely update our training page for upcoming sessions on our website, but please reach out to us if there is times that are specific to you and your team that would be more convenient, and we will do whatever we can to make sure that we can accommodate your schedules. We're thrilled to, again, to be a part of this and look forward to speaking with you soon.